Good morning. The topic of my paper presentation is MRI spectrum of rotator cuff injury of shoulder, presented by me, Dr. Astha Chirania, guided by Dr. R.P. Dande, ma'am, Professor JNMC Vardha, HOD Dr. P.H. Parihar, sir. Introduction. Degenerative shoulder arthritis is a common cause of chronic shoulder pain, stiffness, functional limitations, especially in middle-aged and elderly patients. Clinical examination and radiograph have limited role in detecting these abnormalities, and MRI provides an excellent soft tissue contrast as imaging, which helps in early diagnosis, disease characterization, and management planning. The aim of this study is to assess the degenerative shoulder arthritis with the help of MRI, and the objectives being in first to assess the degenerative arthritis features such as cartilage loss, osteophyte formation, joint space narrowing, and subchondral changes. Second, to evaluate the role of rotator cuff tendons such as supraspinatus, infraspinatus, subscapularis, and teres minor, and to assess the associated findings such as muscle atrophy, fatty infiltration, tendon retraction, and joint effusion. The cross section it is a cross sectional descriptive study uh, which was conducted in Department of Radiodiagnosis JNMC Vardha. The duration was 12 months and patient presented with suspected shoulder joint arthritis undergoing MRI. The inclusion criteria includes age more than 30 years who presented with chronic shoulder pain and stiffness, and the exclusion criteria includes recent trauma, prior surgery, inflammatory arthritis, and any contraindication to MRI. The MRI protocol used was first a dedicated a shoulder coin was used in a 3 Tesla MRI scanner, and the following sequence were obtained in that is coronal PDFS, coronal T1, coronal T2, axial and sagittal T2 and PDFS sequences. The MRI evaluation parameter was done using 3 to 4 slice thickness and osteostructure, articular structure, rotator cuff, and associated findings were noted. The osteostructure include osteophyte, subchondral sclerosis, subchondral cyst, and marrow edema. The articular structures included cartilage thinning, joint space reduction, glenoid changes, rotator cuff pathology such as tendinosis, partial and complete tear were noted, with the amount of retraction and fiber retraction, and in associated finding in joint effusion, bursitis, muscle atrophy, and fatty infiltration according to the Gotelier grading was done. The demographic criteria, the sample size was 20, out of which 8 presented in 50 to 60 years of age group. 40% of patients were female and 60 were male, and of which 70% presented with right-sided weakness. Is the presenting complaint, maximum of patient that is 40% presented with shoulder pain, 27 with restricted movement, and 33 with stiffness, with almost 65 had a chronic duration that is more than 12 years. The presentation included a mixed picture, out of which 13 patients presented with degenerative changes, 12 patients presented with rotator cuff tears, and tendinosis was noted in 40 patients. Impingement and was seen in in two patients, and labral lesion was seen in one patient. Coming to the cases, this first case it was a 66-year-old male patient who was a diabetic, presented with right shoulder pain and stiffness in one ear. These are the coronal PD and T2FS sequences where we can appreciate intermediate signal intensity noted in myotendinous junction of supraspinatus, consistent with tendinosis of supraspinatus muscle. This here we can appreciate there is fluid in rotator cuff interval with thinning of IGHL matching up to 8.7 mm. Here in the societal images, so we can see here the supraspinatus muscle is reaching up to the tangent drawn between coracoid and acromion process, thus indicating mild and atrophy, with few fatty sticks noted in T1 weighted coronal image age consistent with grade 1 Gotelier or fatty infiltration. This is a case 2 who was diabetic and also presented with pain and restriction in movement. And the patient here we can appreciate there is a fluid signals intensity noted in both PDFS and T2 weighted MRI sequence in the articular surface of supraspinatus tendon consistent with pasta lesion. and there is no full thickness tear present, no retraction of fibers was seen, and the bursal surface fibers were intact. This was consistent with pasta, along with in a mild AC joint arthritis with reduction in joint space, irregular surface of the and osteophytes of the acromioclavicular joints can be appreciated. Here we can see fluid signal insensitivity in bicipital groove consistent with tendinosis of bicipital groove. Here we can see the type 1 acromion can be appreciated in sagittal image, and also fluid can be seen in scapular recess. Thus, here this patient was a patient with partial tear, that is a pasta lesion, with bicipital groove tendinosis, with AC joint arthropathy, with subscapular recess, with subscapular bursitis, is representing degenerative spectrum of shoulder arthropathy. The third case was a 52-year-old male who presented with chronic shoulder pain for 8 months, gradually progressing, aggravated by overhead abduction lifting activity. There was no history of acute trauma. Here we can again appreciate T2 weighted and PDFS weighted images, where we can appreciate fluid signal intensity in the bursal surface of supraspinatus consistent with river pasta lesion. And also AC joint arthropathy is seen, minimal joint fluid is seen in subcoracoid and subscapular recess. Source fluid within also type 1 acromion was seen. Thus, this was a case of reverse pasta lesion and with mild adhesive capsulitis and AC joint arthropathy. The next case is a 60-year-old male who had a gradually progressive complaint of chronic shoulder pain for 12 months and was aggravated by overhead abduction. Here we can appreciate the T2 and PDFS coronal images, where we can see full thickness tear of the supraspinatus tendon with tendinosis in myotendinous junction. The retracted fibers can be appreciated 1.2 centimeter away from the foot plate. Here we can appreciate the fluid signal intensity and the retracted fiber, thus indicating the complete tear. Here we can also appreciate the fluid in subscapular recess. Thus, this was a case of full thickness tear. To conclude, MRI present is an excellent modality for evaluation of degenerative shoulder arthritis. It is commonly seen in patients in more than 40 years of age. MRI can detect not only cartilage loss but also rotator cuff abnormalities ranging from tendinosis to complete tears. It is helpful in early detection of degenerative changes and grading of disease severity. It can also is helpful in treatment planning and prognosis. Thank you.